Hi, my name's James Forbes and I'm recovering from a full hip replacement. 2 days ago, I had my left hip replaced using a posterior approach. I'm currently at the Cleveland Clinic Hospital in London and my operation was performed by Professor Alistair Hart. I had my right hip replaced 4 years ago. I had the same problem on both hips, which was called a CAM lesion, which is a thickened area of bone on the neck of the femur that had gradually been wearing down my cartilage over the last 50 years. This has led to a bone-on-bone situation and a labral tear on the edge of my hip socket. So I had a full hip replacement 2 days ago. I'm doing very well with my recovery. I would urge anyone that's having hip pain to go to see their specialist, an orthopedic surgeon. Get a scan done if you can to assess what your issue is, which may be different to mine. I've had the posterior approach used on the previous hip and I wanted to use the same surgeon. The problems that I had whilst my hip was in a bad situation was it was very painful to walk, which was stopping me going out with the family and the dog. Walking upstairs was difficult. Tying a shoelace, putting on a sock were almost impossible. Stepping in and out of the shower. So it was really affecting my life. I run a small personal training gym, so it was affecting my work. I was having to modify what I taught and how I showed clients what to do. So if you're considering hip surgery, go and see a specialist first. The first week after the hip surgery, you are going to be in some discomfort and pain. Wherever you have your procedure done, they will hopefully manage your pain correctly with the right medication. So make sure you communicate with them and tell them what you need if you're in any pain. But I can assure you, as this is now my second hip replacement, that having the procedure and going through the rehab process, following the advice from your surgeon and the physio, will definitely improve your quality of life. So stay tuned for any updates on rehab exercises, and don't feel like you can't go to get your issue checked out. I would urge you to get it checked out. It might be different to my situation, but just to let you know, if you do have a hip replacement, in many cases it will improve your quality of life and allow you to do the things that you were otherwise struggling with. Okay, speak soon.